ஹே ஃப்ரெண்ட்ஸ், இன்னைக்கு நம்ம வந்து ஆக்சுவலாக அந்த கெரோட்டிவ் ட்ரையாங்கிள் பற்றி பார்க்க போகிறோம். ஸோ ஜென்ரலாக வந்து பார்த்தீங்கன்னா கெரோட்டிவ் ட்ரையாங்கிள் வந்து பார்த்தோம்னா த பவுண்டரிஸ் ஆஃப் த கெரோட்டிவ் ட்ரையாங்கிள் வந்து பார்த்தோம்னா த superior belly of the homohyoid and the sternocleidomastoid muscle and the posterior belly of the digastric muscle. ஸோ இந்த மூணு மசில்ஸ் சேர்ந்து தான் the three muscles together it is going to form a triangle, and the base is formed by the posterior belly of the digastric, while the apex is actually this is the apex. The apex is formed by the sternocleidomastoid muscle and the superior belly of homohyoid muscle. And if you see the floor of the carotid triangle, it is actually formed by four muscles. From first, it is actually middle constrictor muscle. So this is actually a middle constrictor muscle. Then it is inferior constrictor of larynx. Then this muscle, the third muscle is thyrohyoid muscle, and the fourth, this muscle is going to be hyoglossus muscle. And if you see the contents of the carotid triangle are very much important. The first, this is going to be the common carotid artery. The common carotid artery is going to get bifurcated. So common carotid artery, and this is going to be external carotid artery and internal carotid artery. And another content is going to be the internal jugular vein. Not only the internal jugular vein and the carotid artery, we also have the important nerve, that is the vagus nerve. Vagus nerve is actually the 10th cranial nerve. So in between the internal jugular vein and the carotid internal carotid artery, we have the vagus nerve. We also have the ansa cervicalis, which is actually a loop formed by the cervical C1 and C2 along with the hypoglossal nerve. The 11th cranial nerve, that is the spinal accessory nerve, it also runs in a different manner, in a C-shaped manner. We also have the carotid sinus and carotid body, which are actually the carotid sinus is actually a bulge-like enlargement in the common carotid artery. The external carotid artery is going to have a 5 branches that is going to be seen within the carotid triangle. 5 branches are superior thyroid artery, the one which is coming down. This is going to be the superior thyroid artery. The going up is going to be the lingual artery, and the third is going to be the facial artery. Fourth one is going to be the occipital artery, and the fifth one is going to be the ascending pharyngeal artery. So this is all about the carotid triangle. The applied aspects of the carotid triangle include compression of the carotid common carotid artery. If you see, the common carotid artery can be compressed at the C6 level. That is C6 level. That is what we call as Chayesnak's tubercle. In case of any bleeding or any rupture of the artery, we can compress the artery at the Chayesnak's tubercle. That is the level of C6. Carotid pulse. Carotid pulse can be felt in the carotid triangle. You can palpate the internal carotid pulse in a person in actually either in the right side or in the left side. Carotid sinus syndrome. If you see this, the carotid sinus, this is actually a it is going to act as a mechanism in reducing the heartbeat. That is what we call as carotid massage actually. Thank you. Let's see you in another session.